Do you frequently feel like your leg is sore, swollen, or heavy, especially when sitting for a long time, like during a long flight or car ride? What if I told you that it might not just be tired muscles, but something serious happening inside your veins? That could be deep vein thrombosis, or DVT. DVT is when a blood clot forms deep inside a vein, usually in your leg. It's sneaky because it can happen without obvious signs, but if that clot breaks loose, it can travel to your lungs and cause a life-threatening problem. So, feeling that weird leg pain, let's figure out what it could be. What causes DVT? Think of your blood like traffic on a highway. Normally, blood flows smoothly. But if the traffic slows down or stops, like during long flights, bed rest after surgery, or injury, the blood can pile up and form a clot. Other causes include genetics, if your family has a history of clots, being overweight, smoking, or even taking certain medicines like birth control pills. For example, imagine Sarah, a 32-year-old office worker who took a 10-hour flight. She sat the whole time without moving much. A few days later, her leg swelled up. Why? Sitting still too long made her blood flow slow, creating the perfect condition for a clot. That's DVT in the making. How do you know if you might have DVT? Ask yourself, is one leg swollen more than the other? Does it feel warm, red, or tender when you touch it? Does it hurt more when you stand or walk? These are big red flags. Let's say John noticed his left calf was sore and bigger than the right one after knee surgery. He ignored it at first, thinking it was normal pain. But the swelling didn't go down. That's a classic DVT sign. Some people don't feel anything at all, which is why DVT is so dangerous. And remember, if you suddenly have chest pain or trouble breathing, the clot might have moved to your lungs. That's an emergency. Call for help immediately. How do doctors find out if you have DVT? It usually starts with a simple ultrasound. It's like taking a video of your veins to see if there's a clot blocking blood flow. Sometimes they do a blood test called D-dimer. If it's high, it suggests a clot might be present. Treatment: the goal is to stop the clot from getting bigger and prevent new ones. Most people take blood thinners, medicines that don't actually thin your blood, but stop clots from growing. For example, Emma was prescribed a daily injection and later a pill after her diagnosis. In rare cases, if the clot is huge or dangerous, doctors might use special procedures to remove it. The key is early detection and following your doctor's advice. Can DVT be stopped before it starts? Absolutely. Think of it like locking your door at night. Simple habits make a big difference. If you're sitting for a long time, stand up and walk every hour. On a long flight, do ankle circles in your seat. Stay hydrated. Water keeps your blood flowing well. If you're at higher risk, like after surgery, your doctor might give you compression stockings or blood thinners as prevention. Imagine Tom, a truck driver. He now sets a timer to stop and stretch every 2 hours. Small change is big protection. Also, quitting smoking, losing extra weight, and staying active all help reduce your risk. Prevention isn't hard, it's just being mindful. Scientists are constantly working to make DVT care better. One recent advance is better blood tests that detect clots earlier. Newer blood thinners like apixaban or rivaroxaban are easier to take because you don't need frequent blood tests like older medicines. Some hospitals now use smart devices that remind patients to move or take their medicine. Also, researchers are studying genes to see who's more likely to get clots, so prevention can be personal. For instance, a recent study found that people with a specific gene change benefit more from early treatment. The future may be a simple skin patch that detects clots before symptoms appear. Exciting stuff.